public health physician, Dr. Jamiu Ganiu, joins us right now via Skype from Lagos. We'd like to thank you for joining us on the program. I'd like to begin with the first question, and that is the role of community leaders, which has been said to be critical to the COVID-19 response. Do you think that there is sufficient community drive in raising awareness for COVID-19 sensitization, testing, contact tracing?
Thank you for that question. Actually, it has been our concern that the community leaders need to be involved. I remember I was part of the contact tracing, especially the acute case search during the early stage of the response. And I realized how important the community leaders are, in the sense that these are people that are so close to the people in the community. They command some of respect in the community, and I think people listen to them. So if these people are being used as role model, leading the contributing in terms of helping with the response, creating awareness, linking them, sensitizing them about available resources, the services in the community, I think it will go a long way in ensuring that we limit a kind of encourage compliance, and at the same time, it will also limit, some myths and misconceptions, since these are people actually respected in the community. So by the time these people play a kind of key role, people will actually assess some of those disbelief, and as well, it will also help them to be able to kind of, believe in what is happening, and in so doing, that might create a kind of awareness, so that people can actually believe in all what has been an issue all along with regards to the lack of compliance. Thank you.
Dr. Ganiu, what's your take on the pace of Lagos State? We heard from the governor, his briefing, how, SS3 can begin August 3rd. We're looking at ramping up of testing capacity, but it's still recording daily rise in cases in the city.
Yes, as I've said, I've been, all my concern all along has been the issue of us a kind of spending more effort on preventive measures. How do we ensure that people comply? The other time I mentioned that some people, that no matter what you do, they will not comply. So we need some level of enforcement. And this has to do with clear understanding with the general populace. Without actually spending more effort on preventive measures, I'm sorry, we may continue to record more cases. I agree, we need to scale up testing. We need to build more isolation center. We need to partner with the private sector. But I think we need to really work on our preventive measures. How do we ensure people comply with all the preventive measures? Because if you look at it, even at the beginning, after the phase 1, we still had issue with lack of compliance. At the end of phase 2, the same thing. So I'm a bit worried about other, easing out, like the issue of, opening the airport, school, and so on. I think we need to still work on the issue of preventive measures. How to ensure people comply. And even I'm even a bit worried, like with the airport, we've said a lot of things about that. You see, at the beginning, we are very good on paper, a lot of good guidelines, paperwork and so on. But my worry is that when it comes to issue of compliance, that is when the issue will become. At the beginning, actually, people will comply. But the sustainability issue has been the issue. How do you sustain the idea of people complying with all these measures? That has been the concern. We have been worried about the cases, but it has to do with actually the number of testing. It has actually scaled up. But we still need to, spend more effort on preventive measures. How do you ensure people comply with all the preventive measures? Thank you.
All right. We'd like to thank you, Dr. Jamiu Ganiu, public health physician. Thank you for joining us on the program.
Thank you very much.